The cardiovascular system includes three things. We have the heart, the blood vessels, and the process of circulation itself. Heart, blood vessels, and the process of circulation itself. The blood in our body moves around our body. So, and that's what circulation is all about. So, the structure of the heart, the structure of the cardiovascular system. The heart is a fist-sized muscular organ. If you form a fist with your hand, like you're going to box someone or eat someone, that's about the size of the heart. And if you check this structure, you will see that the heart is located between the two lungs. Okay, that's where the heart is located, between the two lungs. I have formed a circle here. So this is the right lung and this is the left lung. So you will see that the heart is more tilted. The heart is more tilted to which of the lungs? Who can tell us?
The left lungs.
Eh? Which one?
I said the left lungs.
Yes, it's more tilted to the left lung. Okay, so it's between the lungs and it's just like a machine, and what it does is that it pumps blood throughout the body. That's what it does. So for the circulation, there are two kinds of circulation. We have the pulmonary circulation and we have the systemic circulation. I believe by now you know that when we say pulmonary, we are referring to what? The word pulmonary refers to lung. So we have the pulmonary circulation and we have the systemic circulation. So for the pulmonary circulation, the right side of the heart pumps blood to the lungs. And the reason why it has to pump blood to the lung is so that the blood can get oxygen from the alveoli of the lungs. So just take note of that the right side of the heart is involved with pulmonary circulation. And what it does is that it pumps blood to the lungs for oxygenation. When we breathe in oxygen, it goes into the lungs. And the part of the lungs where it goes into is the alveoli of the lungs. Okay. So the other one is the systemic circulation. And the left side of the heart is involved with systemic circulation. It's very straightforward. How is it straightforward? They said systemic. So systemic means the body system. So the left heart side of the heart pumps oxygenated blood that already has oxygen, to the rest of the body. Okay, so the picture here is just depicting the position of the heart, and the heart is located in the mediastinum. That's the space, and it's more tilted to the left. So the left lung has a notch, a cardiac notch, because of the heart resting on that part. So let's talk about the blood vessels. We have majorly the arteries and the veins. You have the artery and the veins. The artery, then the smaller arteries, the arterioles. What they do is that they carry blood away from the heart. And the arterioles lead to the capillary. Then the veins and venules. The veins and venules carry they carry blood to the heart. Okay, so and usually veins we have valves to prevent the backflow of blood. The capillaries are just small vessels, and they are for exchange of gases and nutrients. And our blood vessels have 3 layers. We have tunica adventitia, that's the outer layer. We have tunica media. The tunica media is the smooth muscle, the middle layer of smooth muscle and elastic tissue. Then we have the tunica intima. That's the inner endothelial layer, and is present in all blood vessels. So this is what we are trying to talk about. This tunica intima is present in all blood vessels. By all blood vessels, we mean it's present in arteries, it's present in vein, and it's present in capillary. Now, that's for the tunica intima. That's the endothelial layer, or what we can refer to as the endothelium. Okay. But you see, the tunica adventitia and the tunica media, they are not present in the capillary, because the capillary is just a layer of endothelium. That is what is in the capillary. It's a layer of endothelium. So this tunica intima layer, which is a layer of endothelium, is present in all blood vessels. Okay. In the artery now, the arteries that are closest to the heart, the ones that are very close to the heart, okay, they contain more elastic tissues in their tunica adventitia. You know, I told you tunica adventitia is made up of smooth muscle, that's one, and is made up of elastic tissue. Okay, so but if you see the arteries that are very close to the heart, they contain more elastic tissue than smooth muscle. Then the arteries that are far from the heart contains more smooth muscle than elastic tissue. And do you know why? Who can tell me the reason why the arteries close to the heart have more elastic tissue? Anybody who can? The reason why the arteries close to the heart have more elastic tissue is because, you know, when the heart pumps with force, okay? So when the heart pumps with force, the artery must expand. It must expand. So that's why it has more elastic tissue. The arteries close to the heart must expand to accommodate the blood that the heart is pumping. So that's why the arteries close to the heart have more elastic tissues than the artery farther away from the heart. Okay. So let's talk about anastomosis and end arteries. You see, when we say anastomosis in the circulatory system, what we are referring to is just collateral circulation. And this was how I explained it. You see, artery carries oxygenated blood to all organs in your body. So if it is only one organ, let me give you this example, your leg. If it is only one artery that supplies your leg, once that artery is blocked, once that artery, anything happens to that artery, then your leg will stop functioning because it will not be receiving oxygen again, and it's as good as it's dead. All right. So that's what happens. So when it is only one artery that supply an organ, we call that artery end artery. End artery. If the artery is the only one supplying the organ. So for end artery, nothing must happen to end artery. Okay, because it is the only organ artery supplying that organ. If anything happens, then that organ will die. So examples include the artery supplying your retina. The retina is in the eye. Once anything happens to that artery, you go blind. That's what happens. You go blind because it's an end artery. But for anastomosis have other collateral circulation, meaning that it is not just one artery. The arteries are connected like branches. So if anything happens to the main artery, the collateral arteries will be there to supply that organ. So that's what this means. This one, just know the explanation. They usually don't ask. So capillaries, like I said, it has just one layer of endothelium, and they are permeable to water and small molecules. Then we also have sinusoids. Sinusoids are larger. They are also leakier capillaries, meaning that they can leak their content, okay, leak them out. And they are commonly found in liver and bone marrow. So the veins carry blood back to the heart, and they have thinner walls than the arteries. They also contain valves. The valves is so that the blood will flow in one direction. It will not flow back, okay? So the blood flows in one direction. That's what the valve ensures. The valves in the veins of your body ensures that the blood flows in one direction and that they are not flowing back. They flow to the heart. So while venules are smaller veins that are leading from the capillaries. So there's always exchange of gas between the capillaries, between the blood and the body tissues. This is what we refer to as internal respiration. That's internal respiration, all right? Now, so let's move straight into the anatomy of the heart. So the heart is also a muscular structure, and it comprises of three layers. We have the pericardium, which is the outer layer. Then we have the myocardium, the middle muscle layer, and we have the endocardium, which is the inner layer. So the pericardium is an example of that is found in the pericardial cavity. And it consists of two layers, the fibrous layer and the serous layer. So the myocardium is the middle layer, and it's a muscular layer. It's the middle layer of the heart, and it's composed of muscles. The muscles are cardiac muscles, cardiac muscle. They are specialized, and they are intercalated discs. They contract, and the contractile action ensures that the blood is pumped out. Okay, so let's talk about the heart valves. We said the valves prevent backflow of blood. Okay, first and foremost, you must know that the heart has 4 chambers. 4 chambers. One is the first one. 2. I'm not drawing this well. This is second chamber, third chamber, then fourth chamber. So the heart has 4 chambers and is divided into 2 sides, the right and the left side. The atrium, the right atrium is one chamber, the right ventricle is another chamber, the left atrium is one chamber, the left ventricle is another chamber. So the heart is made up of 4 chambers, and it is divided into 2 sides. Okay, so the valves of the heart, this is one. This one separates the right atrium from the right ventricle and is a tricuspid valve. It's a tricuspid valve from the superior and inferior vena cava. You know that deoxygenated blood from the body enters the body through the inferior vena cava and the superior vena cava. If the blood is coming from the lower side of the body, it flows into the inferior vena cava. If the blood is coming from the upper part of the body, it flows into the superior vena cava, and it enters the right atrium. By the time it enters the right atrium, okay, the tricuspid valve, which is the valve between the right atrium and the right ventricle, must open for the blood to enter into the right ventricle. We said that the blood enters the heart through the right atrium, all right? Then from the right atrium, the tricuspid valve opens for it to flow into the right ventricle. Then from the right ventricle, it's the pulmonary valve has to open. When the pulmonary valves open, the blood now enters the pulmonary artery, and from the pulmonary artery it goes to the lungs to get oxygenated. Once it is oxygenated, it returns through the pulmonary veins into the left atrium. Okay. Now, when it returns into the left atrium, the mitral valve, that's the bicuspid valve that is between the left atrium and the left ventricles, then opens for the blood to enter into the left ventricle. The left ventricle now pushes the blood, or pumps the blood into the aorta, and the valve between the aorta and the left ventricle is the aortic valve. Okay, so these are the valves that we have. Okay, so please take note of them. The tricuspid valve is between the right atrium and right ventricle. The mitral valve is between the left atrium and the left ventricle. And what they do is that they prevent blood from flowing back into the atrium. Okay. Then the pulmonary valve is at the entrance of the pulmonary artery. So it's between the right ventricle and the pulmonary artery. So while the aortic valve is between the left ventricle and the aorta, and it prevents the backflow of blood into the ventricles. So the heart has 4 chambers and has 2 sides, left side, right side. From the right ventricle, who can tell us where the blood is going to? We have said the right part is for pulmonary circulation. So from the right ventricle, where will the blood enter?
Pulmonary artery.
Pulmonary artery. So pulmonary artery, we take it to where?
To the lungs.
Pulmonary artery, we take it to the lungs. So what will happen in the lungs?
It becomes
Yes, it becomes oxygenated. So after it becomes oxygenated, where will it go to?
the left atrium.
No. What will carry it to the left atrium? What is going to carry it to the left atrium? The pulmonary vein. The pulmonary vein. So from the left atrium, where will it go into?
Left ventricle.
Left ventricle. Then from left ventricle, where is it going into? From left ventricle, it is going into the aorta. The aorta will now pump. It will now go into all body organs. So the heart itself needs blood because it is also an organ. So if the heart is not getting oxygenated blood, there is problem. So the artery that gives the heart its own oxygenated blood is called the coronary arteries. Yeah, so the coronary arteries give the heart its own oxygenated blood. Okay, coronary arteries. Have you heard of CAD before? Coronary artery disease. When there is coronary artery disease, the blood will not get enough oxygen. Once it's not getting enough oxygen, the heart begins to have problems. So that's what gives rise to issues like myocardial infarction, angina pectoris, and some of those issues. There are issues with the coronary artery of the heart. So if they ask you which artery supplies the heart, What will you say?
Coronary arteries.
Very good. The coronary artery supplies the heart. So, no, we've been able to establish that the heart pumps. The heart is pumping. Okay. So, but it has some electrical activity, and that's why it is able to pump. So we can then call this electrical activity the conducting system of the heart. So these electrical impulses that make the heart pump, it starts from the sinoatrial node. Okay, this sinoatrial node is located somewhere here on the right atrium, and it is called the natural pacemaker of the heart. Okay, the electrical impulses start from the SA node. The SA node will first fire. The SA node is the heart's natural pacemaker. Okay, so what's the heart natural pacemaker? The SA node, sinoatrial node, is the heart's natural pacemaker. Then we also have the AV node too, atrioventricular node. This is not a pacemaker, but it also generates impulse, or it gets impulse. Impulse is passed to it, okay? And is located at the atrial septum. This atrioventricular node, it delays impulse before passing into the ventricles. And the impulses are passed via the bundle of His and the Purkinje fibers. Let's talk about this now. The cardiac cycle. Now, the duration of the cardiac cycle is about 0.8 seconds. And our heart rate is like 75 beats per minute. There are phases of this cardiac cycle. We have the atrial systole. When you hear systole in cardiovascular anatomy, it means contraction. Then when you hear diastole, diastole means relaxation. Systole means contraction. So when we say atrial systole, you can break the meaning down. It just means that the contraction of the atria. Then when we say ventricular systole, it means the contraction of the ventricles. So the complete cardiac diastole is now the relaxation of the atria and the relaxation of the ventricles. If you use the stethoscope to listen to the pumping of blood, you will hear two kinds of sounds. We call them lob up, lob up, lob up. That's how it will be sounding. So the first sound is the lob sound. And the lob sound represents that the atrioventricular valves are closing. That's what it represents. Then the second sound, dop, represents the closure of the aortic and pulmonary valves. That's what you hear when the aortic and pulmonary valve closes, okay? So I told you that the heart generates electrical impulses. So usually in the hospital, the electrical impulses are measured by using the electrocardiogram, the ECG machine, and they have what they represent. They will not ask you this in your exam. I think so, because it's a little beyond your scope. So the mathematical formula for blood pressure is that BP equals CO, cardiac output, times total peripheral vascular resistance. This is the mathematical formula for blood pressure. CO represents cardiac output. So, and what is cardiac output? Cardiac output is just the stroke volume times heart rate. We have said that the heart rate is 70 beats per minute. So what is stroke volume? Stroke volume is volume of blood ejected per beat. That is the stroke volume. is the volume of blood ejected per beat, and is at approximately 70 mils at rest. If you are not walking, if you are not jogging, if you have not exercised, 70 mil of blood comes out of your heart per beat. When we talk about the blood pressure, it's usually just basically a measure of the pressure of the blood in the arteries, in the arterial wall, because the pressure of the blood in the arteries are higher than the pressure of the blood in the veins. So when we talk about blood pressure, we are measuring the pressure of the blood in the arteries. And I forgot to tell you something, which is also important. All the veins in the body carry deoxygenated blood, except pulmonary vein. Please take note of this. Let me write it down. All veins of the body carry deoxygenated blood, except what? Except the pulmonary vein. Then also, all arteries of the body carry oxygenated blood, except the pulmonary artery. So what this means is that the pulmonary vein, instead of oxygenated blood, carries deoxygenated blood, while the pulmonary artery, instead of oxygenated blood, carries deoxygenated blood. So like we said, that the blood pressure is a measure of the pressure of blood in the arterial, in the arteries. And you know that the blood pressure, there are two readings. We have the systolic and the diastolic reading. All right. And you use a sphygmomanometer to measure the blood pressure. The sphygmomanometer may be mercury, or it may be digital or electronic. So two kinds of valves. The atrioventricular valves. We have the one between the left and right atrium, and the one between the right atrium and the right ventricle, and the one between the left atrium and the left ventricle. Then we have semilunar valves. Semilunar valves are the valves between any other place apart from the atrium and ventricle. So the valve between the ventricle and the pulmonary artery is a semilunar valve, and we call it pulmonary valve. And the valve between the left ventricle and the aortic valve is a semilunar valve too, and we call it the aortic valve. Okay. And what the valves will help us do is just to prevent the backflow of blood circulating. And I believe by now you know how the blood is circulating. So who can tell us how blood circulates using this picture of the heart? Anybody? Revision can tell us how the blood is circulating from here. Anybody who wants to tell us? Anybody, please.
I want to try that.
Okay.
Okay, sir. The blood flows to the right atrium through the, is from the down part, it flows through the lower vena cava, from the upper part, so superior vena cava. It flows to the right atrium. Of the right atrium is goes to the right ventricle. From the right ventricle, it goes to the pulmonary artery. From the pulmonary artery to the lung. From the lung to the pulmonary vein. From the pulmonary vein to the left ventricle, left atrium. From the left atrium to the left ventricle. From the left ventricle to the aorta.
Yeah, perfect. Apata Victor. Perfect. Good one.